Hi everyone, my name is Jamie Pulsifer and I'll be presenting today on vitamin D. So vitamin D is a fat-soluble vitamin that is naturally present in very few foods. It's added to others and is available as a dietary supplement. Vitamin D is also produced endogenously when ultraviolet rays strike the skin and trigger vitamin D synthesis. So that's right, we get vitamin D from the sun. So the recommended daily allowance for men and women is 15 micrograms per day, and the upper limit for men and women also is 100 micrograms per day. So here are some of the major functions. The one major function that is most important of vitamin D is that it has a hormone-like role in maintaining the body's concentration of calcium and phosphorus. So when blood calcium levels are low, vitamin D promotes increased intestinal absorption of calcium and phosphorus in foods to maintain blood levels of these minerals. So vitamin D preserves the functions of calcium and phosphorus even if dietary intakes of these minerals are inadequate. So another function is that vitamin D helps regulate several hormones like insulin, renin, and parathyroid hormone. It also may be involved in cell cycle regulation, and it may decrease the risk of certain types of infections and autoimmune disease like multiple sclerosis, and offer protection against diabetes, hypertension, dementia, and certain cancers. But the reason I put may in front of these last couple of functions is that most of the evidence comes from observational studies. So additional intervention studies will need to be done to kind of solidify these things and make them true. So some of the food sources of vitamin D are fatty fish, so fish like sardines, mackerel, herring, and salmon are some of the greatest sources where you can get vitamin D, but also another huge one is from cod liver oil, which is something that they used to use a long time ago, like for kids, because kids are some people that are can most get a deficiency of vitamin D. Another big source is fortified milk, and then some fortified breakfast cereals. And then some of the other sources are eggs, butter, liver, and some margarines. But I read that you have to consume much more of these foods to get a lot of vitamin D from it. So the main vitamin D deficiency that we know of is rickets, which is a softening and weakening of bones in children. So vitamin D promotes absorption and calcium and phosphorus from the gastrointestinal tract. So a deficiency makes it difficult to maintain proper calcium and phosphorus levels in bones. So this would be the cause of getting rickets, is having a vitamin D deficiency. And some of the signs and symptoms of this disease is delayed growth, pain in the spine, pelvis, and legs, muscle weakness, bowed legs or knock knees, which you can kind of see in the picture there in the child, and also thickened wrists and ankles, and then breastbone projection. And so I wrote on there osteomalacia too, because that is kind of like the adult version of rickets, but it is a little different. So osteomalacia, not to be confused with osteoporosis, it means soft bones. So poor calcification of newly synthesized bones results in fractures in the hip, spine, and other bones. So that's kind of what osteomalacia is the poor calcification of newly synthesized bone. And this occurs mostly in adults with kidney or liver disease because both of those impair the synthesis of calcitriol. And it also occurs in people with intestinal diseases like Crohn's disease, which impair fat absorption. So for vitamin D toxicity, it would be the excess intake over the UL of vitamin D, which can cause an overabsorption of calcium and hypercalcemia, which is excess blood calcium, which this is really bad. It could lead to deposits of calcium in the kidneys, heart, and lungs. It can lead to anorexia, nausea, vomiting, bone demineralization, weakness, joint pain, and kidney dysfunction. And all of these can also, it can lead to being fatal. So vitamin D toxicity is one thing to look out for, not going over the UL of 100 micrograms of vitamin D. And it also doesn't result from excess sun exposure, if you were wondering. It's just mainly would come from taking a vitamin D supplement and then also getting enough vitamin D in food eaten, but not from sun exposure. So vitamin D's function in metabolism. So this is kind of what I found in the book, is that vitamin D2 is in food or supplements, and then ultraviolet light from the sun converts 7-dehydrocholesterol to vitamin D3 in the skin. So vitamin D is in food and vitamin D3 is from the sun. Dietary vitamin D2 is absorbed with dietary fat in the intestine. Vitamin D from both dietary sources and synthesis in the skin is bound to carrier proteins in the bloodstream and transported to the liver. Vitamin D is converted in the liver to 25-OH vitamin D3, which is calcidiol. Vitamin D is converted in the kidney to 1,25-OH2 vitamin D3, which is calcitriol. So the synthesis of 1,25-OH2 vitamin D3 is tightly regulated by the parathyroid gland and the kidneys. So when there's a shortage of calcium in the blood, the parathyroid gland increases the production of parathyroid hormone, which then increases the production of 1,25-OH2 vitamin D3 in the kidneys to restore calcium balance. So that's kind of how that works with vitamin D and metabolism. So the thing that I found most interesting when researching vitamin D was that there's a risk of getting vitamin D deficiency with a lot of different people. So like breastfed infants, because there's not enough vitamin D in breast milk, and then also with older adults, their skin starts to be no longer able to synthesize vitamin D as efficiently, and a lot of older people do stay inside, so they don't get a lot of sun. People with limited sun exposure, which goes along with that, people with dark skin, people with inflammatory bowel disease and other conditions causing fat malabsorption, like Crohn's disease, and then people who are obese or who have undergone gastric bypass surgery. One thing I found interesting about this was that um, a lot of these had to do with sun exposure rather than actually consuming vitamin D, which I didn't know was so important, getting so much vitamin D from the sun. So what I found in the media, I read an article from Time magazine, and so what they said in there was that there's a lot of information out there about vitamin D suggesting that Americans need more of it because of all of its health benefits, including lower risk of bone fractures, heart disease, cognitive problems in older adults, asthma, and even cancer. But they had a new review of the data, which was conducted by the U.S. Preventative Services Task Force, advising tuning out this hype of needing more vitamin D. And they said that this government-backed group looked at 19 clinical trials and 28 observational studies and found that vitamin D in combination with calcium can indeed help reduce bone fractures, but that as far as cancer and heart disease are concerned, the data just aren't conclusive enough to suggest that vitamin D supplements have any benefit. So this was interesting because the information I've talked about earlier about how it might help with all of these health benefits, that was found in the book, but there needs to be more research done on it to actually prove it. So in conclusion, I would just recommend that we consume enough vitamin D to meet the recommended daily amount, because there can be really bad consequences to deficiency or toxicity of vitamin D. But it also seems like there needs to be a lot more research done on vitamin D and the health benefits of taking more vitamin D, even in a supplement. But we do know for sure that it does help with bone health. So that is my presentation. Here are the references that I used for it.